Learners are required to assess and interpret the situation and make decisions based on information provided. Usually conducted in a laboratory setting, simulation learning allows students to practice a variety of skills, including assessment, psychomotor skills, and decision making. The instructor must determine the goal of the simulation learning activity. Ideally, the activities should be planned so that all students can participate in some way.
No, I have to do it here.
Oh, okay. Yeah, how about blood pressure? Ayan.
To begin a simulation learning activity, the instructor must provide the student some brief, basic information about the situation, along with an objective. This may be done in a number of ways, such as a verbal report or written information. The student is then asked to engage in the situation until the goal has been met.
Is that a voice recording? Both of them, right? Yeah, so there's going to be written on both.
The final phase of simulation learning involves debriefing. The instructor and students discuss the situation, offering feedback regarding what was done well and areas to think about.
My name is Lisa Dela Cruz. I'm here to welcome you as our new faculty at the United States University Entry-Level Master's Program. Nursing program has adopted an educational innovation using simulation technology to enhance the nursing education of our students. Why do you use simulation? Number one, to reduce human error. Number two, to increase the learner's skill development. They can practice performance. For example, in the hospital, my students and I, if we are observing a code, we are just observers. Whereas in the sim lab, we are able to participate, and in addition, the students can even act out the actual code scenario. They can practice in a controlled environment. They can practice real-life events without penalty for mistakes. We can facilitate an on-demand access to the patient. You don't have to come to the hospital. They can just, it's very convenient, they can just come to the sim lab and work with our sim man. Provide an opportunity to practice clinical decision making with low frequency and high acuity situations. For example, at a local hospital here in San Diego, they use the sim lab to train their newly hired employees, and also they use it for remediation if some of their employees need to practice more, need more practice with their clinical skills. As a faculty, you may ask, what leads to effective learning? The sim lab helps us provide effective feedback. We give immediate feedback. At the end of each scenario, we have a debriefing, and we can give the immediate feedback to the student regarding their performance. It's repetitive practice. They can repeat their activities until they perfect it. Curriculum integration. This is when what they learn in the theory, they can go into the sim lab and practice. So then sometimes my student would say, oh, that's what you mean. So when you were talking, and sometimes talking about in theory, they have the background knowledge, and then when they're in the sim lab, they can do the application. Wide variety of clinical conditions, so the students can learn take care of a patient from having a hypertension to hypotension, to a patient having a GI bleed, and to another patient having a code blue. It's a controlled environment, so the instructor is there to monitor the patient's it is a controlled environment. The instructor is there to help monitor the students' response to the scenario, and also optimal learning will occur because there's an immediate feedback. The instructor can guide the students to what information they want the students to learn.